Hello, everyone. This is Hao Tim. I will use the coming 8 or 10 minutes to give a quick introduction about an upcoming summer school in Taiwan. So let me share my screen. Okay, so the summer school will happen from June 25th to July 16th this summer. And the topic is scientific approach toward non-stationary time series analysis for biomedical artificial intelligence. So what are we aiming for? Just recall your life experience. Actually, you got a tons of data from the hospital over a long period. For example, you can easily get tons of data in the hospital and nowadays, because of the advance of technology, you can also get a lot of data at home, different years, different time. I will not go into details of each one, but you can see the richness of what's going on. A natural question to ask is, with this rich database, what can we do with it? For example, can we better understand our physiology, get a better health management, or have a better future prediction? That is, if we can unlock the information hidden in this rich database, we can peep into our body from different angles at different times with different lens. As you can see, it is very rich, very diverse. How can we cover everything in 3 weeks? Impossible. So we will focus on the continuous data. What is continuous data? Let's take the 12-lead ECG as an example. This is the image you commonly see in the hospital. Physician will read it in a printout paper or in iPad, read the image and give you a diagnosis. But what is the raw data underneath? This is the raw data. If you open it in Excel, you will see that the first row indicates the channel's name, and at each column, it gives you the recorded data. In this case, there will be 250 data points saved per second. That is, the sampling rate is 250 hertz. So this number can be different based on with different machines or settings. No matter how, discretization is inevitable and necessary because we cannot save continuous data. So we can call it high frequency data or time series database that we will do the analysis. So what is the relationship in between the raw data and the image you get? So in Excel, you can use the plot function and get the ECG signal, where X is the time and the Y is the number. And that will be the raw data we will analyze instead of the image in this whole lecture. So there will be different clinical needs and challenges. Let's take a 14 days ECG as an example. You can see this is 14 days signal, which you cannot see too much. We zoom in 1 day, 1 hour, 1 minute. Finally, you can start to see the spikes, 10 seconds. Then you get to the ECG signal that you are familiar with, isn't it? We can ask many questions. For example, how can we better visualize this ultra long signal, right? Can we use it to do some monitoring, to do prediction? There will be a lot of questions we can ask, and how to achieve it, how to understand this continuous data. In my humble opinion, we will go through the model and analysis route. For just like the traditional scientific breakthrough, F equals ma, E equals mc squared. They are all models, gravity, and so on. So once we have the model, we do the analysis, and so that we can get the underlying structure of the continuous data. So we will follow this scientific argument in this summer school to analyze continuous data. We'll have model, algorithm, do the missions like prediction, and use mathematics as the main language so that ultimately we may be able to better understand our body. So in this summer school, we will cover several different models for continuous data, ranging from deterministic model to stochastic model. Overall, we will call it phenomenological model, and its further relationship with other models will be detailed in the lecture in the summer school. So based on the model, we will introduce different algorithms developed based on the model and describe the relevant theoretical supports so that we know why and how and why and when it works. And all topics will be split into 3 blocks, and each will take about 1 week. And you may ask, How Tin, why not just use deep learning? Anyways, someone claims that AI will replace us soon. No? Well, in my personal opinion, deep learning can be very useful if science is not the focus. If we want to use it for scientific purpose, there is still a way to go because it's still a black box in nature. Although it has been already very successful in the industry, in this lecture, we will focus on scientific exploration. Okay, so for this purpose, we will gather different experts from different fields to provide uh, different angles, opinions. For example, from applied math and statistics, we will have Professor Lerman, Steinerberger, I myself, and Joe to join. From electrical engineering, biomedical engineering, we'll have Professor Colonius, Liu, Pani, and Talman to join us. From the medical clinical perspective, we have physicians, Dr. Zhou, Lin, Chai, and Wang to join us. We will also arrange hospital visits so that you will get first-hand experience for data collection and know the unmet needs, why it is important. During the summer school, you will also experience and learn how to collect data using the device and collect data yourself. For example, this device, okay, which will give you PPG and the IMU, and this device, which will give you the ECG so that you can get SKNA signal and also patient monitor and also polysomnography and so on. Okay, sounds interesting, isn't it? Good, right? So where will it happen? It will happen in Taiwan, which is in East Asia. And it will happen actually in the northern part of Taiwan, which is in Academia Sinica, Taipei. And the Taiwan, if you look at this island, it looks like a whale, isn't it? And this island, we have several good reputations. For example, it's very good, it's very democratic with freedom. It has a top healthcare environment, high life quality, and low crime rate. It is very safe and high PPP, purchasing power parity. And people in Taiwan speak English well, so you don't need to worry if you cannot speak English. Okay, so when will it happen? It will happen from June 25th, Wednesday, to July 16th, also Wednesday, 3 weeks in total. So there will be some key dates. The application deadline will be March 9th. So if you have interest, please remember to apply before that date, and there will be notification of acceptance. There will be some financial support and so on, some details that you can find more details in the summer school website. If you have any question, you can send me email using the email in the website. And the application will via the Mass Jobs, so you can easily find it. And hope this brief video give you an overall idea of what you can expect and what you will explore in the summer school. And look forward to your participation. Thank you very much. Bye-bye.